The Health Service Executive has said it's putting contingency measures in place after pharmacists claimed the country was just 10 days away from a crisis in the supply of medicines. The warning was issued at an emergency meeting of the Irish Pharmacy Union, called to discuss the row over the government's decision to cut their fees.
Around 1,000 pharmacists attended today's emergency meeting in Dublin to discuss the government's decision to cut the fees it pays them for dispensing medicines. The Irish Pharmacy Union has sought an urgent meeting with the Health Minister with just 10 days to go before 1,100 pharmacists stop dispensing medicines under community drug schemes. The union says the cut is 34%, a figure disputed by the Health Minister, who has put the reduction at 24%.
We are facing a crisis. This crisis can and should be averted, and this crisis can be averted. We are available to talk if the Minister wishes to talk to us.
The schemes affected by the action are the medical card scheme, which covers just under 1.5 million people, and 60,000 people on the long-term illness scheme, who get medicines for conditions like diabetes, epilepsy and Parkinson's disease. Some pharmacists told today's meeting they will stop dispensing methadone to patients who need it. The Irish Patients Association has called for outside intervention to resolve the dispute.
Again, I say patients must not be used as pawns by any party in an industrial dispute.
Health Minister Mary Harney said pharmacists will still earn high margins from dispensing medicines, even under the new fee structure. And she said that over 800 pharmacists would continue to dispense medicines to customers despite the row. The HSE says it is concentrating its efforts on contingency planning to ensure patients get their medicines at alternative locations.
As I say, 1,100 pharmacists provided a very good community pharmacy service for 30 years. We're not trying to replicate that, just provide a contingency to make sure patients have access to services.
The executive has called on pharmacists engaged in the action to help patients have their prescriptions filled elsewhere. Fergal Bowers, RTE News, Dublin.
Members of the